Leukemia could be a cancer of the blood or bone marrow. Bone marrow produces blood cells. Malignant neoplastic disease will develop because of a tangle with vegetative cell production. It always affects the leukocytes, or white blood cells. Leukemia is presumably to have an effect on folks over the age of 55 years, however it's conjointly the foremost common cancer in those aged below 15 years. The National Cancer Institute estimates that 780 folks can receive a diagnosing of malignant neoplastic disease in 2019. They conjointly predict that malignant neoplastic disease can cause 840 deaths within the same year. Acute leukemia develops quickly and worsens quickly, however leukemia gets worse over time. There are many differing types of malignant neoplastic disease, and also the best course of treatment and a person's likelihood of survival depends on which kind they need. In this article, we offer an outline of malignant neoplastic disease, causes, treatment, type, and symptoms. Causes: leukemia develops once the polymer of developing blood cells, principally white cells, incurs harm. This causes the blood cells to grow and divide uncontrollably. Healthy blood cells die, and new cells replace them. These develop within the bone marrow. The abnormal blood cells don't die at a natural purpose in their life cycle. Instead, they build up and occupy more room. As the bone marrow produces additional cancer cells, they start to overcrowd the blood, preventing the healthy white blood cells from growing and functioning usually. Eventually, the cancerous cells add up healthy cells within the blood. Risk factors: there is a variety of risk factors for malignant neoplastic disease. A number of these risk factors have additional vital links to malignant neoplastic disease than others. Artificial ionizing radiation. This might embody having received radiotherapy for a previous cancer, though this is often an additional vital risk issue for a few sorts than others. Certain viruses, the human T lymphotropic virus, HTLV1, has links to malignant neoplastic disease. Chemotherapy. Those who received therapy treatment for a previous cancer have the next likelihood of developing malignant neoplastic disease later in life. Exposure to benzene. This is often a solvent that makers use in some improvement chemicals and hair dyes. Some genetic conditions: youngsters with 21 trisomy, birth defect, congenital anomaly, congenital defect, congenital disorder, congenital abnormality, retardation, mental retardation, backwardness, slowness, subnormality, have a third copy of body 21. This will increase their risk of acute myeloid or acute leukemia to 2 to 3%, that is on top of in youngsters while not this syndrome. Another genetic condition with links to malignant neoplastic disease is Li-Fraumeni syndrome. This causes a modification to the TP53 factor. Family history. Having siblings with malignant neoplastic disease will cause an occasional however vital risk of malignant neoplastic disease. If an individual has a homogeneous twin with malignant neoplastic disease, they need a 1 in 5 likelihood of getting the cancer themselves. Inherited issues with the immune system. Bound transmitted immune conditions increase the danger of each severe infections and malignant neoplastic disease. These include ataxia telangiectasia Bloom syndrome, Shwachman-Diamond syndrome, Wiskott-Aldrich syndrome. Immune suppression. Childhood malignant neoplastic disease might develop because of the deliberate suppression of the system. This may occur following associate in nursing surgery as a baby takes medications to forestall their body from rejecting the organ. Several risk factors would like any studies to substantiate their link to malignant neoplastic disease, such as exposure to magnetic attraction fields, exposure to bound chemicals within the geographic point, like gasoline, diesel, and pesticides, smoking using hair dyes. Types: there are 4 main classes of leukemia. Acute chronic lymphocytic myelogenous chronic and acute leukemias. During its period, a white vegetative cell goes through many stages. In leukemia, developing cells multiply quickly and collect within the marrow and blood. They exit the bone marrow too early and aren't practical. Chronic leukemia progresses additional slowly. It permits for the assembly of additional mature, helpful cells. Acute leukemia overcrowds the healthy blood cells additional quickly than leukemia. Lymphocytic and myelogenous leukemias. Doctors classify malignant neoplastic disease per the sort of vegetative cell they have an effect on. Lymphocytic leukemia happens if cancerous changes have an effect on the sort of bone marrow that creates lymphocytes. A leukocyte could be a white vegetative cell that plays a task within the system. Myelogenous malignant neoplastic disease happens once the changes have an effect on bone marrow cells that turn out blood cells, instead of the blood cells themselves. Acute leukemia children below 5 years recent are at the best risk of developing acute lymphocytic leukemia all. However, it may have an effect on adults, usually over the age of 50 years. Out of each 5 deaths from all, 4 occur in adults. Chronic leukemia. This is most typical among adults over 55 years, however younger adults may develop it. Regarding 25% of adults with malignant neoplastic disease have chronic leukemia (KIA). It's additional common in men than in ladies and infrequently affects youngsters. Acute myelogenous malignant neoplastic disease. Acute myelogenous malignant neoplastic disease (AML) is additional common in adults than in youngsters, however overall, it's a rare cancer. It develops additional usually in men than in ladies. It develops quickly, and symptoms embody fever, issue respiratory, and pain within the joints. Environmental factors will trigger this sort. Chronic myelocytic leukemia. Chronic myelogenous malignant neoplastic disease (CML) largely develops in adults. Regarding VJ day of all malignant neoplastic disease cases within the USAR-CML. Youngsters seldom develop this sort of malignant neoplastic disease.